Talk today on atrial fibrillation. Atrial fibrillation is basically an irregular heartbeat. Your rhythm of your heart is irregular, chaotic. So heart beats sometimes faster, sometimes slower, and it causes stasis of the blood inside your heart chambers, and that causes formation of clots. And when these clots are dislodged and goes to any other organs, it clogs the arteries and results in several complications. One of the major complications is cerebrovascular accident or brain stroke that we commonly call it, and that is the most dangerous complications of long-standing atrial fibrillations. Atrial fibrillation is a age-related disease, and along with that there are many other diseases that predisposes the development of atrial fibrillation. One of the most common is systemic hypertension, the high blood pressure that ultimately gives rise to certain changes inside your hearts and development of these atrial fibrillations. Along with that, other risk factors like diabetes, renal disease, liver disease, dyslipidemia, and many other factors also play roles. So the most important therapy in atrial fibrillation is rate control, rhythm control, and of course anticoagulation. That is taking some medicines which makes your blood thinner so that the clots does not form, or the brain stroke can be prevented in long run. We have been seeing a lot of prescriptions where the suboptimal dosage of anticoagulation are being prescribed, but make it very clear that if you are taking anticoagulation to prevent development of brain stroke, then you have to take it in proper dosage. There are different kinds of blood thinner or anticoagulations, and based on several scoring system, we call it CHADS-VAS score, CHADS-VAS-C. This score actually helps us to make a clear-cut guideline that which anticoagulations and in which dose you should take. And there is another score that we call Has-Bled score, based on which we prescribe these medications in optimal doses, so the risk of bleeding is also can be minimized. So the take-home message is, if you're suffering from irregular heartbeat, you should need to check for atrial fibrillations. You have to go through some of the investigations like ECG, echocardiogram, and Holter reports, and based on that you need to calculate the score, consult with your physician, and you should take anticoagulations to prevent development of brain stroke. Thank you very much.